President Biden signed an executive order today to protect reproductive rights in a post-Roe America. He delivered impassioned remarks condemning the Supreme Court and the extremist wing of the Republican Party.
We cannot allow an out-of-control Supreme Court working in conjunction with extremist elements of the Republican Party to take away freedoms. Just last week, it was reported that a 10-year-old girl was a rape victim in Ohio. 10 years old, raped, 6 weeks pregnant, already traumatized, was forced to travel to another state. Imagine being that little girl. I'm serious. Just imagine being that little girl, 10 years old. Well, for God's sake, there's an election in November. Vote, 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 vote. Consider the challenge accepted, court.
The order directs HHS to boost access to abortion pills and contraceptives and aims to protect the privacy of those seeking information on abortions, including online. The move comes as a growing number of states adopt laws to ban or restrict abortion care in the wake of the Supreme Court's decision, including Louisiana, where today, under a new court order, nearly all abortions are now illegal. Joining me now is Dr. Yashica Robinson, medical director of the Alabama Women's Center for Reproductive Alternatives, and who testified during a House Judiciary Committee hearing on abortion care access in May. And just to set the stage, at the risk of bringing back a bad memory, from your testimony, I want to play a moment that resonated a lot online. This is the questioning of you by Congressman Mike Johnson.
If a child is halfway delivered out of the birth canal, is it permissible to have an abortion? Would you support the right for an abortion then?
I can't even fathom that ever.
I'm not asking you if you can fathom it. If it occurred, would you support that abortion or not? That's unrestricted abortion, right?
That's a question that I can't imagine. Just like you probably can't imagine what you would do if your daughter was raped.
I feel like I played that for you, Dr. Robinson, because I feel like the people who are making these laws don't understand anatomy, biology, or sort of normal human life, because asking a question like that is so absurd that I can see why you couldn't even figure out how to answer it. What do you make of the fact that, including in your state, mainly men are banning abortion when they genuinely don't seem to understand basic biology? Oh, you're muted.
I completely agree with you. The people that are making these decisions, they don't understand basic anatomy, healthcare, and what pregnant people really need. But it also makes it very clear that they're not interested in learning, because people like me are willing to, make ourselves available and talk to them about the true life experiences of our patients so that they can understand. But it doesn't seem like that's important. I think what's more important is what gets their party out to vote and get them in. And so, the facts don't really matter.
I mean, just to clear it for people who might send this video around to their, grumpy, ultra-right Christian uncle, there is no such thing as aborting a child that has already been born. That is just not a thing that is real.
No, but that's the thing that that sounds appalling to me, but that's not real life. That's not abortion. That's not what abortion care is. And so I think for people who don't understand, for people who've never, who are not medical, and people who've never had to make that decision, I think when you have politicians that paint pictures like that, it gets people on their side and it gets them votes. And I think that's the only thing that really matters.
What was your response to the president's, executive order today to try to protect people who try to just look online or try to search information about how to get abortions and protecting access to abortion pills? Do you think that will help women in your state in Alabama?
Well, initially when I saw it, I just made it in from the hospital about 15 minutes ago. But when I saw it, I opened my phone up and I saw it and I got really excited. But I am not a lawyer, so I didn't understand what it meant. And so then as I talked to people to understand, my response is I'm happy to see that there's some support there. However, it's not enough. It's too little, to really help patients and to increase access to the care that we really need. I'm glad to know that there's efforts to protect access to medication abortion that doesn't help people in states like Alabama, where we can't, we're not able to treat the patients at all.
And we know in states like Mississippi and Louisiana and Alabama, basically all the abortion clinics have closed. Can you talk a little bit about what that means to the other kinds of care that these kinds of facilities offer? For a lot of women, you know, Planned Parenthood or other clinics are actually their only health care, period.
Mm-hmm. Well, that means that all of those other essential services are going away, in addition to the ability to take care of patients who, you know, opt for care in these centers just because it may be more cost efficient for them. It allows them access to care in a setting where they're not able to access it in the hospital. It gives them access to physicians who will give them the care that they need, even when their private physicians are unable or unwilling to care for them in very complicated situations.
What's happening with your former patients in Alabama? What are they going to do now? Are people telling you they're going to need to leave the state? Like, what's going to happen to these women?
I mean, yes, we're hearing people that say that they really they will have to leave the state for care. But the thing that's most heartbreaking is the people who are not able to do that. And those are the people that I care for. That's the majority of my patient population, people who do not have the means to travel. And those are the people that are going to be harmed the most. I also hear from physicians who don't understand what this means. I talked to a physician today and she says, well, so what does that mean? You can only go up to 15 weeks. I'm like, no, we can't care for any patients. They also, it also came up in our surgery center. Someone said, well, are we even able to do this D&C? In the end, the patient did get their D&C, but what that tells you is that physicians, very educated people who are capable of taking care of patients, are second guessing, proceeding with the care that they know patients need.
Yeah, and that's going to have deadly results for a lot of women. And in your state, just to be clear, there is no rape or incest exception.
No, there's not.